There is only one of you, only one of me. There's a million.
Hi guys, welcome back to my YouTube channel. As promised, I had said that I'm going to post a video on the 20th of July. So this is it. This video will focus on oral care and dental health, and a little background as to what has inspired this video is that in my family, I believe I am the only one that has the most difficulties with dental health. By the age of 13 years, I had already started extraction of my molars. I think zisagano zitatu zinali kuti ndazichosa by the age of 15. And one time I had a terrible cavity, and I remember going to Queen Elizabeth Central Hospital with my mom. And that day, I don't know if I should say we were very unfortunate. It happened that at the dental department, there were students from, I believe, from the health sciences. It was a long time ago. And, I went there for a molar extraction. Nde tinakhala kumene kuja anandichosa dzino lija. So I went back home thinking ndoti ndathana ndi vuto limene. When I got home usiku ndikangomva ngati mina ngati malofu akutuluka mkamwamo. So I took a cloth ndikumalavula pa chinsalu paja kumalavula thinking ndi malofu. In the morning when I woke up, I realized kuti anali magazi. There was blood all over my bed. Then I was rushed to the hospital. It just happened kuti like 3 people that we had met the previous day, my patient now shaman had also reported to the hospital again the following day. Akudandaula zinthu zosiyana ena kuti I think ikosalira dzino, ena kuti chani, ine ndinali vuto lokuti I was bleeding throughout the night. And my mom was like, what was that doctor? My mom was very clever. She was like, mwanayu wataya magazi mwina around 2 liters usiku wonse. Adokota ayamba kuseka kuti amayi mwana akataye 2 liters akathe kuyenda uzafika chipatala kuno. 2 liters is a lot of blood. I'm sure she was just trying to emphasize on how much blood I had lost throughout the night. So anandisoka. I stayed with those stitches for about a week. That is how the opening healed. I think a dentist amana and just adzino siku limene lolo wanangobujukumula basi, instead of removing it with care. Yeah, so in this video we will have a chance of talking to a dentist. It just happened that at the time of conceiving this video, I had received a call from the dental clinic that my routine professional dental cleaning was due. And so I'll take this opportunity to take you along to the clinic, so we'll have a chance of talking with a professional on some of the things that we can consider in order to improve our oral wellness. We will ask him about certain myths about oral health, so that all of us, as we are meeting, nobody should be complaining to the other person. All right, so let's do this. Alright guys, so I'm on my way to the clinic. I wonder a lot of times kuti ndimakumana ndi anthu kuti aini mano obowoka, they are in excruciating pain. I think munthu aliyense amafunika amvetsetse kuti mtendere wa dzino lobowoka kumapezeka kuchipatala kakuchosa dzino basi. There's no any other way about it. So chintu china chimene ndimakonda kumachimva kwa anthu, especially anthu amowa amakonda kumanena kuti akuti munthu amowa sangadwale dzino loboka.
Hello.
Hi.
Yes, sir. How are you?
I'm good. How are you?
I'm good. And how can we help you today?
I'm here for my routine professional cleaning.
When I think about all my plans, everything I need, always want more money to spend, cause I got these mouths to feed.
So we encourage that you come here every 6 months for checkup, cleaning and stuff. This does not depend on whether you are feeling pain or you have a certain challenge with your teeth, but just a routine. Just make it a routine. Like now, this is July, meaning your next session or you'll be due for checkup in January next year.
Some people never learn, but they're not gonna work.
Thank you. I'm Joseph Matewe.
Okay.
Dental therapist working with Exos, especially here at Gateway Dental.
All right. I have a couple of questions that I want to ask you. Some are myths that I want you to discredit.
Yes.
Some are just questions just so that you can share information with me. Many people fear going to the dentist. In your experience, what drives this fear and how can patients overcome it?
Okay. Dentistry is one of the medical fields that involves mostly surgical procedures and injections and stuff. So whenever people hear the word dentistry, all they see in their mind is, they are going to inject me. They are going to do maybe a surgical procedure like removing a tooth and stuff. So those things are some of the reasons why people fear coming to a dental clinic, and particularly maybe some of the people who came to a dental facility, they were assisted, but maybe there are some other complications. Maybe during the procedures, those are some of the things that make people, to be frightened with this department.
All right.
Sure.
If you had to recommend just one habit for maintaining excellent oral health, what would it be?
Teeth brushing.
Teeth
Yes.
brushing.
Oral care, that's it. You just make sure you brush your teeth. Not less than 2 times a day. In the morning after breakfast. And at night when going for bed. That's enough.
All right.
Sure.
But I like to brush my teeth before breakfast. Is there
That's
any,
not right.
why?
Because when we clean plates when they are dirt,
Okay.
you use a plate, you clean it and keep it.
Okay.
That's how we do. So even with teeth, you use them to eat. Let's say you had a good breakfast, sausage and stuff. So probably after that you have some of stuff remaining in your mouth. So you need to clean to remove such stuff.
All right. There's a lot of advice out there. How often should we really be brushing our teeth each day?
Just as we have discussed. I've said we should brush teeth not less than 2 times a day. We can do 3 or more times, depending on how your time is, your schedule is. But most importantly, we brush them after meals. In the morning, after meals, and most importantly, at night when going for bed. After eating, you want to eat anymore.
Between liquid floss and traditional string floss, which one is more effective?
Traditional.
Okay.
Because that thread, you push it, you direct it, even in very tight kind of spaces. All the liquid floss, you push it like an water checker. So it can go some areas with force, but some other spaces it may not get there, effectively. So the traditional one is better.
Does timing of floss matter?
It does.
Okay. Is it better to floss before bed or in the morning?
The most important part maybe when you are going for bed, because you assume you have plenty time, so you
Yeah.
can do it nicely. In the
Yeah.
morning, most people are rushing to work, business and school, so they can do it just to make sure they are done. So the best time can be when you are going for bed.
All right. Is it true that one can clean their teeth regularly, floss, and have regular checkups, but still suffer bad breath?
Yes, because bad
Yeah.
breath, also known as halitosis,
Yeah.
comes due to a number of factors.
Yeah.
Some of which are maybe systemic, they are maybe emanating from
The stomach.
inside your
Okay.
stomach. and
Yeah.
stuff. So even if you blush, but if you have some underlying conditions also like diabetes, HIV and other stuff, you still have those challenges.
All right.
Sure.
We often focus on caring for our teeth, but what about the tongue? What's the best way to take care of it?
Blushing. When you are brushing your teeth, we also need to be advised to brush the tongue.
Okay.
So you pull it out and you brush it nicely, and avoid taking, very hot stuff. Yeah.
All right. Anthu amowa amakonda kunena kuti alcohol lowers the risk of cavities. Is there any truth in this?
No, that's just a myth.
Yeah.
Of course, alcohol plays a number of roles in the body.
Yeah.
Because element alcohol, lower risk of cavities. Alcohol, then isn't that evidence, or maybe in essence, food and the food. There's a research made up until the local Canada, I mean, some compare with the cavities, and the chances are high. They just use the reason without more.
Okay.
Yes.
What about when one has a painful cavity? Is using alcohol a reliable home remedy, or does it do more harm?
Before these modern medicines were discovered or introduced,
Okay. All right.
alcohol so that drunk penika yomweyo komajabe kuti 40 somehow it's made
Yeah.
then yagama use moja so it's true more matautandiza group peni jesubu virus watamo uja peni jema virus.
All right. There's a growing trend of using charcoal to brush teeth. From a scientific point of view, does this help?
Pamono kumano kwambiri zimalitsira chifukwa you don't know what kind of tree was used to come up with that charcoal.
Yes.
Mitengo ine makandizi, zimautomoni,
Yeah.
and stuff. So
Yeah.
if you use such kind of trees, you have gums
Yeah.
and some other soft tissues.
Yeah.
So you use the charcoal as a yes,
Yeah.
but now your gums and the other soft tissues are affected. So alcohol is a yes, but it's somehow challenging to know which tree is good to use when it comes to the charcoal thing.
All right. I once heard that scurvy can be passed through kissing. Is this a fact or a fiction?
It's a fiction.
Okay.
Because scurvy is just deficiency of
Yeah.
vitamin C.
Yeah.
So I don't know if you think.
So for those that don't know scurvy is to say head.
Yes, you say.
Yeah.
So it comes due to deficiency of vitamin C.
Alright.
The food, fruits more vanilla, and some of your food items you are taking is very lot of vitamin C. You can have scurvy. Kissing, what I know is good we pass saliva.
Saliva, yeah.
They matter pass my bacteria and stuff.
Alright.
But not in scurvy.
Thank you so much, Dr. Joseph.
You're welcome.
Thank you.
You're welcome.
Hi guys, this marks the end of what I had prepared for you. I hope you enjoyed it. I hope you have learned so much on oral care and dental health. So until next time, I'm your girl, Irene AK. Continue watching, liking, subscribing, and sharing.